Hello and welcome to Ukraine Today. I'm Volodymyr Solohub. Several days ago, Ukrainian President Patriot Poroshenko offered a job of Deputy Healthcare Minister to an American-born doctor, Director of Patriot Defence initiative, which has trained over 25,000 Ukrainian troops in tactical medicine. Now, Madam Ulyana Suprun is joining me to discuss the job offer and challenges ahead. Madam Suprun, welcome to Ukraine Today.
Thank you.
So, Madam Suprun, you're switching from private sector to a government job. How do you feel about it?
Well, for the last 2.5 years, we've been training soldiers, tactical medicine, and trauma care. We've been working with both the civilian and non-civilian doctors in training them in trauma care. Had a lot of contact with the Ukrainian system in the Ministry of Defense and with the Ministry of Health due to the training programs. We all know, most citizens of Ukraine, last year I received citizenship from the President, myself and my husband. We all know as citizens of Ukraine that there is a problem in the Ministry of Health. Healthcare is not at the same level, at the same standard that it is in the rest of Europe. The Ukrainian nation is decreasing in size. Every year more people die than are born. And soon the Ukrainian nation will have 35 million people. In 2050, the projected amount is lower than it was in 1950. And that's a really big problem. What's happening? There are enough doctors in Ukraine. There's more doctors per capita in Ukraine than in Europe. There are enough hospitals in Ukraine. There are more hospitals per capita than in the rest of Europe. The problem is the manner in which the healthcare services are provided to the patients. Quality of care is not very high on the priorities of the way medicine is delivered. In most civilized countries, the patient is at the center of care. The patient is what's most important, and the financing and the system is built around the needs of the patient. In Ukraine, unfortunately, it's the old Soviet system. The system exists for the sake of the system and not for the sake of the patient or the citizen.
Madam Suprun, I know that there is a long procedure for your appointment as Deputy Healthcare Minister. It has to be done by the Parliament. But obviously, you must have discussed your job with the President. When you were discussing, are there any areas which he suggested you would take care of or which you suggested you would like to take care of in the ministry?
Well, I had discussions with both the Prime Minister and with the President and talked about the types of changes that would improve the system of health care in Ukraine. Very obvious changes that need to be done is a change in financing. That'll be a long-term change. It'll take a long time to change that type of system. But there are some quick fixes that we need to do right away. That's in the emergency medical system, in Centre Medicine Katastrof, in the military medical system. Those are already changing and they're already improving. Ukrainians don't have a primary care doctor, so improving and increasing the number of primary care specialists. 63% of the doctors in Ukraine already are primary care specialists. They're just not being utilized effectively. So changing that system and then allowing the doctors to work in a system where they receive an adequate amount of pay, where they are able to practice quality medicine because the conditions around them allow them to. And also on the side of the doctors, continuing medical education, improving the medical education of the physicians, of other medical workers, introducing new professions that don't exist in Ukraine. We've already introduced physical therapists and occupational therapists as new professions. We're planning on introducing emergency medical technicians, paramedics, new specialties in medicine, implementing laws that are already on the books but haven't been implemented, such as recently the Prime Minister announced the law that there would be international or European medications, American, US-made medications that will be available in pharmacies in Ukraine. The law has been passed, however, it hasn't been put into effect. We need to work on that so that the Ukrainian people see that there are changes happening and that there are improvements happening. It's really important to communicate with the Ukrainian people. Much of the Ministry of Health is closed off. Most people don't know what's going on behind those closed doors, and there hasn't been a good explanation on what the changes will be, what the system will look like in the future if these changes come about. And I think that one of the really big issues that happens here is the communication. When I spoke with the Prime Minister, when I spoke with the President, both told me that it's very important to include the Ukrainian people in the decision-making process and to make sure that they are aware of what these changes will be.
How exactly are you planning to do that? How exactly are you planning to include the people in the decision-making process?
Well, first of all, there will be a lot more public awareness campaigns to explain what's going on, and actual discussions in all of the oblasti where you bring people in and ask their opinions, show them what the new system will be like, and have them give the advice on how it could be, how it will affect their lives, will it improve their lives, and what changes they would like to see. Even the simplest thing, today, before I came on air with you, I was having my makeup done. And as I was sitting there, I was speaking to two of the women who were working with me, asking them, what do they want to see? And they were telling me about how in the private industry that they're given an appointment and they know what time they can come in and have their visit with the doctor. Small things like that that are important to hear from people that may not be understood at the highest levels, where perhaps they're looking, or we will be looking at a lot more global issues like public health, vaccinations. However, we also need to realize that medicine is very dependent on its clients or its patients, and that it's important to have quality of care and also good access to the services, and also a pleasant atmosphere in which those services are given. There needs to be a relationship between the patient and the doctor. There needs to be patient confidentiality, and there needs to be input from the patient's side. The Ministry of Health is not responsible for the health of every Ukrainian. Each person is responsible for their own health.
Madam Suprun, you as the director of Patriot Defence initiative, you have a lot of experience of training military. Are you planning, once you join the ministry, to continue this work, or somehow work together with the Ministry of Defence to apply the skills and the knowledge which you have right now and which you acquired throughout your work into these two ministries?
Well, one of my specialties has been one of my points of interest in the last couple of years has been trauma care. Whether it's military or civilian, it's emergency medicine and trauma care. We started with combat lifesaver courses, which is basic first aid for soldiers, and we advanced the courses to teach combat medics and then military doctors. We've now started the same programs through Patriot Defense. We've started the same programs in the civilian sector. We teach first aid courses. We're starting to teach courses in EMT and paramedicine, and we're also already teaching, fourth time already, we're teaching civilian doctors on how to give trauma care. So the same experience that you have in the military can very easily be transformed into civilian experience. That's usually the way things happen in most countries. In the United States, the Tactical Combat Casualty Care Guidelines, which are now followed by all fire, police, and paramedics, had been developed by the military. As we know, the military can do advances in medicine as well as advances in other fields much more quickly because of the needs that are present during wartime. The same thing happens with medicine. Many advancements in medicine happen because of the conflict that's going on. And I think because of what's happening in Ukraine, it's really revealed a great need for the change in the healthcare system. Not only is it because of the war directly where there are wounded, but there's also the large number of internally displaced people that have left Crimea, Donetsk, and Luhansk and have moved into other areas of Ukraine. And that area of Ukraine, those other areas of Ukraine are now overwhelmed by the number of patients. And it's revealed a system that has been really barely hanging on in its last breath to try to keep people healthy and try to keep people alive. So I think that with these difficulties, there also come opportunities. And right now, I think we have a great opportunity to make some really positive changes and to start the process of making long-term changes, which will change the entire way medicine is practiced, the entire way that health is cared for in Ukraine.
Madam Suprun, the Ministry of Healthcare right now does not have a minister. Do you know how you will be working? Will you wait until the minister is appointed and then you will join the ministry, or you'll join the ministry before the minister is appointed? How is it going to work in your case?
Well, the ministry cannot stop working without a minister. There needs to be a lot of work done, everyday work, a lot of reforms, a lot of changes that need to be done. The Verkhovna Rada, the Parliament of Ukraine, is now going out of session, and they won't be back in session until September. Only the Verkhovna Rada can appoint a minister. He is, or she would be nominated by the Prime Minister, and the Verkhovna Rada has to vote to appoint them. Therefore, if we waited until a minister came, nothing would have been going on since the last minister, Kvitashvili, left. The work needs to continue. When and if I receive the appointment, then I will begin working as soon as I'm able to come into the ministry through the procedural issues that need to be done, and I would be ready to work from the first day coming in and starting to work. When it comes to who the minister is going to be, that's not really up to me. That's up to the Prime Minister, that's up to the Verkhovna Rada, that's up to those people to decide who they want to see lead the ministry.
Well, Madam Suprun, we can only wish you best of luck in your endeavors, and thank you very much for finding the time to come and talk to us today. We were discussing the new job offer of Deputy Healthcare Minister with the Director of Patriot Defence Initiative, Madam Ulyana Suprun. I'm Volodymyr Solohub. Thank you for watching Ukraine Today.